Hi, everyone. Welcome to our next webinar in the Aeroflow series. This one is on data-driven strategies, harnessing the unanticipated power of partnerships in value-based care. I'm Mike Cantor. I'll be the moderator for today's session and really excited. We've assembled a wonderful panel that's going to be answering some really important questions about how health plans can unlock the value of value-based care. Let me just share with you, before we begin, a few housekeeping items. The goal of the Aeroflow Advantage Be in the Flow webinar series is really to share with our health plan partners how to better work together, how to accomplish the quintuple aim goals of better quality of care, better patient experience, making sure that we're optimizing the cost of care and reducing it wherever possible, ensuring that the providers and as providers, that when we work together, the provider experience is excellent, and that we're addressing inequitable access to care issues, and ensuring that everyone gets the care they need, regardless of their characteristics. And so this is another in a series that we put together. Just as a quick reminder, you can find all of the webinars online. Recently, we've talked about maternal health equity, the use of continuous glucose monitors for diabetes mellitus patients, and also about how to enhance member experience, especially during open enrollment for health plans. And so today's is really an exciting opportunity to get together with a great panel and talk about how health plans and providers can work together to provide better care for our members and patients. Let me, before we begin, mention that if you have questions, we really hope you will, because we want this to be as interactive as possible. If you're online with us today, we really hope that you'll be able to put some questions in the chat. And when we finish the sort of preset questions that we put together, we'll be able to jump into the questions that you send us as well. So let me introduce very briefly the members of our panel. Like I said, we've got a great group today. Really excited about this conversation. Ryan Bullock is the Chief Strategy Officer at Aeroflow Health. Kate Moss, Manager of Marketing, Development, and Outreach for Centera Health Plans in Virginia. Lauren Bennett, who's a Chief Operating Officer for Aeroflow Health, sorry, and Amanda Minimi, who is the Director of Corporate Development at Aeroflow Health. And I'm Mike Cantor, the Chief Medical Advisor for Aeroflow, and I'll be your moderator for today's discussion. So let's jump in. Let's talk about these data-driven strategies and how we can harness the power of partnerships to really move things forward. And again, we've got a great panel. Let me begin with this first question, which is going to be for Amanda, Ryan, and Kate. So Amanda and Ryan, maybe you can start, and then Kate, you can add your thoughts at the end. How can health plans effectively collaborate with their provider community, including durable medical equipment or DME providers, to ensure that it's a seamless and well-coordinated approach to delivering value-based care?
Yeah, I think that's a great question. Immediately, I think of the phrasing of like building a care team, and I think it's so important to recognize that there's multiple providers that play a part in a patient's care journey. What we've seen be really effective is when they map out that patient journey. Who are those patients engaging with? When are they engaging with them? And where are the opportunities? Looking at those patients that did something really well, what helped them achieve it, and maybe those patients that still had opportunities, how can we backtrack and help them achieve those opportunities where there might be gaps? I think there's a ton of solutions that are in place, especially when you look at unlikely providers like DME, that can really be tapped into. And I don't know, Ryan, if you had anything to add there.
Yeah, I would say the first thing that comes to mind to me is opening up the lines of communication with the health plans and DME suppliers. And as you mentioned in that patient journey, and understanding what are the touch points that we go through as a DME supplier, and what does that journey look like for the patient through our lens, and taking that and applying that to what does that look like for the patient's journey through the health plan partner, as well as the larger care team that's managing that continuum of care for the patient. I think one of the ways that we try to approach that is through an integrated solution. It has allowed us to capture over 1 million patients per year, that we are able to build solutions that meet the patients where they want to be met. And I think that's really what is most important to us, and what we strive for every day in the tools and products that we build for the patients that we work with. Another way is around notification of pregnancy. And I think in a lot of cases, we're finding out early on that mom is pregnant. She begins the breastfeeding journey process, typically late in the first, early in the second trimester. And I know, Kate, I believe this is something that you and your team have taken advantage of. Would be curious your feedback on the value in getting that information early on.
Yeah, so we've had really great partnership with Aeroflow and specifically with our mom and baby program. And one of the great advantages has been receiving that member level data, which allows us to really outreach that member more timely. And the data provides us with accurate phone numbers, addresses, information on the member and what they've reached out to Aeroflow for. It's really allowed us to actively engage that member and utilize the information quickly, more timely, more efficiently. And our partnership has really our goals of our mom and baby programs have aligned. So it's allowed us to really utilize and leverage the information.
Really helpful. And I think that the point is really to have that collaborative approach and really work together to ensure that the member, the patient, is getting what they need at the right time. And it's really hard to do that unless you're actually working really closely together, both on the plan side and from the provider side. Which leads me to the next question, which is, Ryan, Amanda, why is it important for health plans to engage with DME vendors? What can they gain for their members by working more closely with organizations like yours?
DME is definitely the unexpected partner. I think that's unfortunate. When you look at where patients are engaging, you have DME providers engaging with patients on a monthly basis. Arguably, they're probably one of the most engaged with the patient provider types that there is. So it's such a missed opportunity. So because we're working with those patients on a monthly, daily, quarterly basis, there's this opportunity that we've had to build a relationship with these patients, and that opportunity to extend that trust that patient has in us as a provider to their health plan is really important. I don't know if
Yeah, I would kind of adding on to that. One of the things that comes to mind to me is trust in healthcare, and I think that's been something that resonates throughout the continuum for patients, and making sure that we are or health plans are identifying those that have built trust with those patients. And I think it's an opportunity for that collaboration, as Dr. Cantor had mentioned, for us to open lines of communication, allow us to collaborate. In a lot of cases, as you mentioned, Amanda, we're contacting those patients on a weekly, monthly, depending on the product line, every 2 to 3 months even. So we've built a lot of trust with that patient. Being able to tap into that, I think, can go a long way for a health plan. And then once I think you have the trust built and those lines of communication open with a health plan, it can allow us who are on the front line building that trust with the member to take those goals of the health plan and help try to drive those through, either with engagement back to the health plan or engagement to the patient themselves. There's opportunities for us to gather data such as social determinants of health, even the potential for mental health assessments, et cetera. And I think that's where a lot of opportunity can be unlocked in these relationships.
As we think about it, certain types of DME, like supporting moms who are breastfeeding their babies, like you said, Amanda, it's a very frequent interaction because they need supplies, materials, and support of all kinds on a very regular basis, especially when they're beginning their breastfeeding journey. And to your point, Ryan, that creates trust. When you're a mom and you're struggling to get through the day and there's a place where you can go and get information that's actually helpful to you and get the supplies you need in a timely fashion, that's really, really important. And I know that health plans generally struggle with engagement with their members. It can be very hard for them to actually figure out how to create that trust and then engage with them directly. Kate, what's your sense of how, there's one thing to talk about partnership, but what's the real, like, how does this work in the real world? Like, Centera made a decision to partner with Aeroflow. How is that going? And what have you seen in terms of any differences in outcomes as a result of that true integration collaboration?
Yeah, we've seen, well, one, just identification of pregnancy, of course, on an ongoing basis. So we're getting active files, from Aeroflow that identify these members. And that helps us to be able to contact them, and we can talk to them about, oh, I see you've reached out to Aeroflow. How was that experience? And we can engage them in our program. We can talk to them about their breastfeeding journey. We can support them and provide them with additional resources. So it really helps us, get a positive rapport forming with that member, and we're leveraging what Aeroflow is able to provide us and able to do that, to be able to do that. And it really goes back to, like, I heard Ryan and Amanda speaking to that patient experience, that member experience, because we know that if we can provide a more optimal member experience, we can hopefully see improved health outcomes. So our goals need to align, at the health plan level, the DME level, the provider level, the physician level, on what we want to see out of these members. And so our ability to work together has led us to see increased engagement in breast pump utilization, in breastfeeding, our members that report they want to breastfeed, and we can support them through that journey. One of the great benefits with our relationship is that we offer programs with longevity. So the members really go through a cycle, through their experience with working with us, from pregnancy to postpartum to having that baby. So it's really a wraparound service that we're able to provide, and we're able to do it together. So we've just seen really great benefits, really great member feedback about their experience in working with Aeroflow and engaging with us. So it's been a positive experience.
It's really kind of a continuum of care that you put together by collaborating with Aeroflow from the health plan side. I'm just curious, from the Aeroflow side, Amanda, what are your thoughts about, like, what pieces did you put together that you could then help Centera members access? Like, how have you thought about what that continuum should include when it comes to breastfeeding specifically?
I think it's a great question. So to kind of piggyback a little bit off of Kate's pieces too, is it was more than just getting the data file feed. I think what we've also been able to do is extend the trust by notifying them that they're going to receive outreach from their payer partner. And I think that warm handoff encourages and facilitates better engagement. So it's not just the accuracy of the files, because you do have patients who may have not updated the state with their updated information, but they are actively seeking products and classes and providing accurate information there. But that warm handoff, that introduction into their health plan, that notification and empowerment that they may be able to get additional resource through their health plan partner is really important. The secondary piece of that is that collaboration. So I know early on, we partnered with them and we were able to incorporate some communications. They had goals and objectives that they wanted to cover. So whether it's like dental care for baby, there were some pieces that they wanted to incorporate in that communication timeline that we were able to facilitate for them. And it's a good wraparound service. It's ensuring that those patients are constantly and consistently receiving the communication that will help that health plan achieve their goals.
Maybe, Kate, you can say, like, specifically, like, when your team members are engaging with new moms or moms who are breastfeeding, what specifically are they doing? And is there that collaborative, like, referring to Aeroflow Health information and ensuring that the information that they're getting from both is the same, right? That's one of the big problems we have in healthcare, is lots of information is flowing, but it doesn't seem to be well coordinated or always say the same thing. So how are your team using these materials is what I'd like to understand a little bit better.
Yes, so our team is using several materials from Aeroflow, co-branding on educational content. Our members are getting that material in their enrollment packets, in their postpartum packets. We're also educating members on the benefits, and one of the benefits being that they can access breast pumps through Aeroflow and other additional services such as lactation classes, educational content. They can reach out anytime to speak with someone at Aeroflow. So we include all of that information in our programming, and also our baby shower events and other events that we run for our members. We're able to educate them on the services that are provided, and we kind of weave that into our program because we want our members to breastfeed. We want our members to be able to have access to the best pumps, the best services, because they have a right to that. So we are working really closely with Aeroflow frequently. We do in-services to re-educate not only our team, but additional team members within our organization on the benefits of Aeroflow and how they integrate into our program and how we kind of integrate into theirs. So those are just some of the ways that we've been able to work together.
Fantastic. So it's not just here's a data file with a list of people who are pregnant. There's a whole continuum of communication, collaboration, co-branding, training together, really working together to engage that member and to help them with their journey. Ryan and Amanda, just a quick question for you. What are the key drivers in terms of what that health plan should think about with identifying those steps? Like, what are the key steps that Aeroflow has identified that you and Centera, for example, never miss or try to never miss when working with a pregnant person and a mom who's breastfeeding?
I can jump in a minute. Maybe you can pick up the pieces where I miss. But I think holistically, just looking at it from the highest level, as I mentioned previously, is we want to, as an organization, meet the patient where they want to be met and kind of how they want to be met through this process. And with that, I think that drives patient engagement. It drives trust in healthcare, as we've talked about. And then the next layer down is we want to ensure that we're providing quality products. We want to make sure that the patients are adhering to the therapy or product and service that's being provided to them. So I think that from a high level is really what we're focused on and obsess about daily. Amanda, I don't know if you have anything you want to add specific to the relationship here.
Yeah, I mean, I think a point of escalation is really important. Like, can they identify where there's a failure or an opportunity? And is there a point that they can escalate to? Do you have that connection? Because I think the idea is that we're not leaving a patient isolated. So it's meeting the patient where they want to be met. And I think there has to be a mechanism that we're identifying somebody's at risk and that there is this opportunity to bring in the rest of the care team to really treat what might be happening.
Great. Lauren, this one's for you. So we heard a little bit about data sharing. So you send a list over when you've identified that someone is pregnant, beginning their breastfeeding journey by looking for breast pumps or other breastfeeding support. Just curious to know, in addition to that, what other kinds of data are you sharing with partners like Centera? And do you see improvements in data like rates of breastfeeding or the length of time that moms are breastfeeding that you share also with the plans in terms of being able to provide some quality data that's helpful for them in terms of meeting their requirements?
And I'm happy.
Sorry, go ahead, Amanda.
Yeah, I'm happy to jump in on the first part there. I think notifications of pregnancy is just the start. I think there is truly so much information that is just untapped. And when we truly map out that patient journey, you can see where the follow-up points are. And I think you can identify like what was the commonality between those patients that achieved this great outcome and where are we recognizing gaps, and is there a mechanism for us to intervene? Where we have really invested a ton of effort is on health literacy. And I think that's something I know Lauren can speak more deeply on. But I think just even at a fundamental level, we don't understand our insurance. We don't understand what our subscriber ID is. We don't understand what benefits are covered. And I think we've dedicated so much effort into improving that process. And I don't know, Lauren, if that's something you can share more about, because it is such a cool thing that we've been able to achieve.
Yeah, I mean, I would say, Aeroflow Health has been really dedicated to not only providing patients, to build on what Amanda was saying with the, breast pump or CPAP supplies they need, right? But it's also about educating that patient along the way and being really transparent in the products and services that we're providing. It builds trust. We leverage the information that we get from a health insurance plan, and we really get deep into the details of going as far as their plan number, their group number, even the network within that health insurance plan to determine here's kind of everything this mom can receive. And just by collecting a little bit of information from her, we're able to say, hey, you may need this, and per your health plan, you are eligible to receive it. And because we have your due date, we know the time frame in which you're eligible to receive it. And another, really big piece of that has also been we found a lot of success in assessing how patients best respond. Every patient is different. Some patients want to hear from us on the telephone. Some are just never going to answer the phone. And they're incredibly responsive via email. And so we're able to do deeper education, get more responses from that patient, going the email route versus the phone route. And I think that's information we can share back and forth with health insurance plans for them to also be able to get better, in touch with their patients more quickly. Hey, here's the modality of which they're most available.
Very, very helpful insights, and important to point out that every member, every patient has their own preferences. And it goes back to, I think we talked about earlier, meeting the patient where they are, meeting the member the way they want to be met. And so otherwise, most people are so busy or dealing with other issues. If you don't make it easy for them by following their preferences, it's really not going to happen. In addition to being able to engage people successfully, what are some specific challenges or barriers that health plans face when trying to align with the provider community, especially including the DME providers? We're trying to move towards a value-based care model where you're really focused on a journey outcomes rather than sort of one, fee-for-service interaction at a time. And this is for the whole panel. What are some of those challenges and barriers, and what are you guys doing to address those barriers and challenges today? And who wants to start? Amanda, do you want to go first?
Yeah. A couple of barriers really come to mind. I think one is that we put so much emphasis on the financial model of it. And so you'll see like capitation or sole sourcing, which is of course the goal that we're all marching after. We all want to have some financial gain, some financial achievement that generates a lower cost to the patient and satisfies the providers and health plan partners. I think where we potentially hit some failures is that that becomes the key driver. So it's not looking at what is a patient actually doing, how is the patient actually navigating through, is that really part of their care team? And it becomes a bigger burden on our health plan partners because they're having to steer patients that they otherwise may not have to steer. I think if we can look at who's already in the markets, get an assessment of how they're actually performing in those markets. What is the perception by the provider community, by the health plan community, by the patient community, and how are they all engaging together? I think that'll give us a good indicator of who we should be pursuing a value-based partnership with. And then I think there has to be some sort of reward mechanism. I think we spend a lot of time looking at complaints as an indicator. So lower complaints might be a good indicator that someone's valuable, but what we don't look at is, are they actually a great provider? What is the general perception of them? What is their customer satisfaction?
So you're suggesting it isn't just the absence of complaints, but the net promoter scores or CAPS or other sort of health plan focused or health provider focused measures of patient experience are really important as well. And that, of course, makes a huge amount of sense. We also know from literature that if you don't give people a good patient or member experience, they don't trust you. As we've talked about earlier, without trust, they're not going to follow along and adhere to what you're recommending, even if it is better for their health. There's a lot that affects human behavior when it comes to this that goes beyond just rational following of advice. Kate, from your perspective on the health plan side, what do you see as the challenges and barriers, and how can we work together to address those and move towards value-based care?
I think some of the challenges and barriers, obviously communication, that has to be there, communication, collaboration, aligning of goals for programming, and at the provider level. So we want increased patient engagement, member experience, but we also want good health outcomes. So just making sure we can, increase access for the members to get what they need. So that's just a huge part of this, especially with the DMEs. We can develop their care plan goals. One of their care plan goals is providing the opportunity for them to have access to what they need to achieve those goals. So I think just, consistent communication, utilization going in and out. So the supply and demand from, the health plan to the DME. And so it's really worked out with Aeroflow, kind of how we got started years ago. It was like, okay, who is providing what we need? But not just providing it with a program and providing with that wraparound care and service. And so that really drove us in to being like, that's the one, and we want to build a relationship and move forward. So, so really that volume compromise has really helped us, I think both of us, based on, our utilization and what Aeroflow has to offer and the timeliness they're able to offer it.
Really helpful. I'm sorry, Amanda, go ahead.
No, I was going to kind of echo what you said. I think you're exactly right. I think truly it takes collaboration. I don't think the outcome can come from a singular provider. I think it's going to take effort as a whole for us to achieve that outcome. And I think all the parties that are participating should be rewarded and should be incentivized to collaborate together, whatever that incentivization looks like. Because it truly takes a team to achieve those outcomes and those goals.
If I could jump in as well, I think taking that team aspect, I think of traditional interdisciplinary teams that come together to focus on either a patient caseload or just a collective of what we're all trying to accomplish in serving the patients and members that we serve. I wonder, and this is, more broadly speaking, if there's an opportunity for establishing forums to where those patient journeys, I think a patient journey within a health system, within a health plan, within a specialty clinic, so forth and so on, there's gaps in care, I think, that can be identified by bringing that interdisciplinary team together to map out what those journeys look like for each group, and then come together and identify areas of opportunities for improvement. What are best practices in this value-based care world that we're trying to define? I think it's difficult on the DME side. We're kind of towards the end of that spectrum, but I think there's opportunity bringing us to the table and playing a role in that care management.
That makes a huge amount of sense, because you're absolutely right. There clearly are gaps all along the journey. And let me ask this to you, Lauren, as the COO. I mean, not every DME company takes this approach where you're adding in programs and services. And for Aeroflow, it's not just the mom and baby, the breastfeeding that we've been talking about, but sleep apnea, diabetes, and continuous glucose monitors, urinary incontinence. How has Aeroflow approached figuring out where the gaps are, and why have you chosen to make the investments, both in terms of the partnership and the ongoing support, but to build these programs? And I know you're still working on building new ones all the time. Why do that? Like, what have you seen as a result that you point to, and think is so key to the success of Aeroflow Health?
Yeah, I mean, I think that we see, I guess there's kind of a number of ways to go about this. One of the things that we really try hard to offer patients is a choice in the process. And I don't know that that's something a lot of patients experience kind of in the process of receiving healthcare. And, you know, that's a place where we try to make that feel like an experience where that patient has some control over what maybe not a great time in their life. We've talked a lot about, you know, the mom and baby space, and that's typically a very happy time, but getting diagnosed with sleep apnea or continuous glucose monitoring and having to go that route, those are not always exciting, fun things for a patient. So I think, you know, we've really focused on that patient experience. And in doing that, have been able to identify places where it can just be done better. And we can offer the patient, you know, experience that feels more like an everyday life, where they have choice, and they're kind of in control of the process.
So what kinds of choices does Aeroflow and Centera, is it different in the case of the mom and baby space, different models of breast pumps? Is it different kinds of classes or different approaches to lactation consulting? Where do you see some specific examples that have made a difference and prolonged the length of time someone's breastfeeding, or just made it easier for them to initiate and maintain breastfeeding even at all?
Yeah, I mean, specifically, you know, the patients have choice in their breast pump, right? And I think that's really important. It's a incredibly personal decision to make for that mom. But another piece of that is just giving her the choice to have access to lactation services via telehealth. Um, you know, I think we've been pleasantly surprised at how willing patients are to engage in the telehealth platform, and how convenient it makes utilizing those services. And it means more moms are getting the education that they need, either to have the confidence to start breastfeeding, or to continue breastfeeding if things are a little bit different or more difficult than they anticipated. And you know, our moms have really engaged in that telehealth platform. We offered them the resource, and they've grabbed a hold of it for sure.
Fantastic. Kate, are there specific things that you think of in terms of where you've developed something together or identified a gap and been able to address it for moms on their journey?
Yeah, so I think kind of going back to just the opportunity for the members or the patients to choose, you know, how much or how little engagement they want during their journey. So I think that is kind of one of the biggest things. So we're providing this opportunity together for them to have access to what they need, but how they want us to communicate with them, whether it be the email, the text, the phone calls, the face-to-face, is truly up to the patient, the member. And so we've, you know, through Aeroflow, some of the gaps, obviously, just that purely that member identification. So it just goes back to that, like those members that we're trying to, you know, these are the same members we're trying to reach. We're trying to engage. We want to help and improve their outcomes. So you know, it's just that engagement, going back to closing that gap of, okay, well, you know, here's a pool of members. This is they've reached out. It's a secure way to have this relationship. And you know, a lot of times, especially in the Medicaid space, it's getting in contact with these folks and being able to provide them with the tools and resources that may help them in whichever manner that they choose. And so really even just goes down to a phone number. So if someone's reaching out and providing their most up-to-date information, that can flow to us so that we can successfully make that outreach, or at least have another opportunity to make that outreach. So that just kind of speaks to one of the major gaps that was closed.
So patient engagement, member engagement, access to service is the beginning of access, I think is your point, which is exactly right. Because if they don't know, or if they don't know how to get it, even if they're entitled to it, even if they need it, they're not going to get it. And so I think you're 100% right. Meanwhile, our time is flying by. So I'm going to ask one last question to the panel more generally. And we've just discussed, sort of meeting patients where they are, meeting members where they are, how they want to be contacted, engaged. What is the role of technology generally, not just in member patient engagement, but how can we use technology to better facilitate communication and collaboration between health plans and DME companies and other provider organizations that are really working towards those quintuple aim goals I mentioned earlier of lower cost, better patient experience, better outcomes, better provider experience, and of course equitable access to care. What do you think in terms of technology is kind of a parting thought in terms of how we can use it to further this collaboration? And Kate, if you want to start, from the health plan perspective, that would be great.
Yeah, I think, well, technology really can help if you can improve, patient engagement, utilizing technology, you can see increased better healthcare outcomes. So I think we use technology now to really drive our interventions and develop our strategies and how we want to deliver care. So, I think utilizing the data, we go back to the data, the information, the real-time access. So if I'm inputting this into the system, how can I get it over to another area that needs it and can benefit from it? Because ultimately we're trying to, help this specific member or this pool of members, patients, have improved outcomes. So technology is key. And I think the more that we utilize it and research ways and that the members can be engaged along the way, I think we'll see, improved outcomes for all of our patients.
Great. Aeroflow team, who wants to go first?
I mean, I would echo Kate. I think we have to embrace technology. I think it becomes a means of us identifying where the gaps in the journey are. I think when you can use technology to kind of identify where the successful models are and identify where the gaps are, you can use that to help notify partners in your care team. So I think it takes a collaborative effort, again, to really embracing technology and what it's there for that will help us facilitate those better outcomes.
Lauren,
I might
Ryan,
jump in.
anything else to add? Go ahead, Ryan.
Yeah, I might jump in and say, just, with anything, it's being careful not to use technology as the sole solution. I think it's opening up lines of communication and determining how technology can be used to, going back to that interdisciplinary team, and we're identifying gaps in care. Can technology be used to bridge, very similar to what Kate had mentioned, that we've been able to do with them, and bridging that gap. I think there's still a long way to go in understanding how to create interoperability among health systems, being able to properly synthesize, aggregate, and bring that data together to have meaningful analysis and be able to make meaningful decisions from that data. A lot of opportunity.
Technology is not the goal. It's a tool, right? And I think sometimes people misunderstand that. Lauren, what would you like to add?
Yeah, I mean, I think what I would add to that, just kind of building on what Ryan just said, is what we've found is, from a patient perspective, technology has made the process more efficient for our patients and our customer service teams, but it's also given us more time and flexibility to really be able to provide more of a white glove solution for patients that aren't as comfortable with technology. And so where we're driving efficiency and communication with patients in the health plan from a technology standpoint over here, it's really allowed us to reach out and be able to touch with greater care and time that more at-risk patient base, and make sure, right, that patient isn't lost in the system. We're able to give that health plan the feedback that, hey, we finally got this patient taken care of. It might have taken a little bit longer, but we had that time because we created more efficiency over here with technology.
Fantastic, and a really, really great way to close. Thanks to all of you for your really great insights and helpful comments and thoughtful approach, not just on the panel, but in the work that you're doing every day to support members who need access to the various breast pumps and maternal child health support, like Kate, like you do with your team, and more broadly for the Aeroflow team also in other areas, the continuous glucose monitors for people with diabetes and urinary incontinence and other important areas too. Just a couple of slides for housekeeping before we end, just one actually. We will be sending out to everybody a link so that you can access this on demand. So if you want to share that link with your friends, please feel free to do that. We're happy to have as many people gain the great insights our panel offered as possible. Also, feel free to subscribe to our newsletter. You'll get an email in the email. There'll be information about how to do that as well if you haven't already. There will be a brief survey. We'd love to get the feedback. As we've talked about, data really matters, and we use it to actually understand better how to make things better going forward. So please send us that information, and feel free to follow us on social media. We're on all platforms, and Aeroflow Health would love to have you as part of our conversation going forward. So thanks again to everybody for a really great conversation and discussion, and really look forward to our next session, which is coming up in just a few weeks, where we'll be talking about the importance of food as medicine and nutrition, and supporting health plans and their members. So thanks again, everybody. Have a great day.